Dementia. What it really means and why we've been getting it wrong. Let's start with a simple but powerful question. What is dementia? For most people across the United States, if I ask you that question, the very first word that will pop into your mind is Alzheimer's. And if I go a step further and ask, what comes next? Chances are your answer will be memory problems. Now, I'd like you to do a little exercise with me. Imagine a chalkboard in front of you. On that board, write these three things: dementia, Alzheimer's, and memory problems. Got it? Now, here's what I want you to do. Take that imaginary eraser and wipe them all away. Yes, erase them completely, because we've been framing dementia in the wrong way. From now on, when you hear the word dementia, I want you to think of just two words: brain failure. Dementia is not only about memory loss, and it is certainly not just about Alzheimer's. That's the big mistake we've been making. We've oversimplified it, and by doing so, we've ignored the real scope of the condition. Dementia is actually an umbrella term, a huge umbrella that covers 80 to 90 different forms, causes, and types of brain failure. When doctors tell you that you or a loved one have dementia, that's not a precise diagnosis. It's a label for a group of symptoms, a syndrome. The real question is, which type? Because not all dementias are alike. The problem with evaluation. Now, here's where things get tricky. Out of every 10 older adults in this country, only 2 will ever receive a thorough evaluation for dementia. 2 out of 10. The rest are given a quick screening that lasts maybe 12 minutes. A doctor asks you what day it is, what year it is, and where you are. You might be asked to remember 3 words: ball, flag, 22, and then do some quick mental math, like subtracting by sevens. If you get the answers right, the assumption is you're fine. If you get them wrong, suddenly the label becomes you have Alzheimer's. But let me be clear, that is not how it works. Some people with advanced Alzheimer's can still pass that test. Others with no dementia at all may fail. It's simply because they've never been strong at numbers or language. What started decades ago as a screening tool, just a first step to see whether a closer look was needed, has mistakenly become a so-called diagnostic tool. It was never designed for that. And it is a poor substitute for real evaluation. Unfortunately, most primary care visits last only 12 to 15 minutes, and doctors simply don't have time. So the screening often gets reduced to a casual question: how's your memory these days? If you say, pretty good, the conversation moves on. If you say, not so good, the answer you might hear is, well, you're 82, what do you expect? And just like that, the concern is dismissed. That's why people often don't get identified until mid-stage dementia, when finances are already in disarray, medications are mismanaged, and family life is falling apart. By then, 5 years may have gone by, and the opportunity for earlier planning and support has been lost. The 4 truths about dementia. So, what exactly is dementia? Regardless of the type, there are 4 truths that apply to all dementias. 1. At least 2 parts of the brain are failing. One may involve memory, but not always in the way you think. Sometimes it's not forgetting, it's misremembering, filling in false details with absolute confidence. 2. All dementias are chronic. These are physical changes in the brain. They cannot be fixed, reversed, or halted. 3. All dementias are progressive. They always get worse, though the pace and pattern vary depending on the type. 4. All dementias are terminal. Every dementia will eventually take a person's life. There are conditions that look like dementia but are not, things like delirium, depression, or certain medication reactions. These are called pseudo-dementias. They can be temporary and treatable, but they often signal a vulnerable brain. That's why people who experience delirium in the hospital are at much higher risk of developing dementia within just 2 years. Alzheimer's, vascular, and beyond. Now, let's talk about the types. For years, we believed that 80 to 90% of all dementias were Alzheimer's. Current research tells us that number is closer to 50 to 60%. That means half of all dementia cases are either something else entirely or Alzheimer's combined with another form. Alzheimer's disease. The most common. Average life expectancy after first symptoms is 8-12 years. It can appear in two main forms. O. Young onset before age 65, sometimes as early as 25, often genetic. O. Late onset after age 65, the type most people are familiar with. By age 85, nearly 50% of adults show symptoms. Vascular dementia, the second most common. This isn't a brain disease itself, but a result of restricted blood flow, often due to strokes, heart disease, or diabetes. Symptoms can remain stable for years and then suddenly worsen. Emotional swings are a hallmark: tears, laughter, or anger that come out of nowhere. Life expectancy varies wildly from 3 years to 30 years, making it one of the hardest to predict. Lewy body dementia, one of the most misdiagnosed, often confused with Parkinson's. Early signs include frequent falls and vivid visual hallucinations, seeing children, animals, or strangers that aren't there. Unlike Alzheimer's, memory may seem intact, but perception is unreliable. Caregiving for Lewy body patients is often the most challenging. Frontotemporal dementia affects behavior, personality, and language rather than memory. People may become impulsive, socially inappropriate, or emotionally flat. Other causes: Huntington's, Parkinson's-related dementia, alcohol-related dementia, multiple sclerosis, and even side effects from long-term medications or cancer treatments. Why identifying the type matters. You might wonder if all dementias are progressive and fatal. Does it matter which type it is? The answer is yes. Early on, it matters a great deal. The type of dementia shapes what a person can and cannot do, how quickly changes will come, and what kind of support will help most. Knowing the specific type helps families prepare, adapt, and care more effectively. As the disease advances, the differences may blur, but in the beginning, understanding the form of dementia can be the key to better caregiving and a higher quality of life for both the person affected and their loved ones. Final thoughts. So let's go back to that chalkboard. Remember what I asked you to erase? Alzheimer's and memory loss. Replace it now with the real definition: dementia equals brain failure. It is not simply about forgetting names or misplacing your keys. It is a serious, progressive, and terminal condition that takes many forms. And unless we recognize it early, we risk losing precious years of preparation, support, and understanding. That's why these conversations matter. That's why we need to shift the way we think about dementia. Because when we know better, we can do better, not just for those who live with dementia, but for the families and communities who walk this journey alongside them. We'd love to hear from you. In the comments below, share one thing you learned today and how you plan to use it in your life. Your insights matter, and we truly enjoy reading what you have to say. It keeps us inspired and motivated to create more. If this video was helpful, please like it, subscribe to the channel, and share it with a friend or loved one who might benefit too. Your support helps us keep making content that informs, encourages, and uplifts. Thank you so much for watching. We look forward to connecting with you again in the next video.